on your side. You're watching WRBL News 3 Evening Edition.
Well, this flu season, the CDC predicts nearly 4 million Americans have contracted flu-related illness, resulting in 32,000 hospitalizations and 1,800 deaths. The CDC says several states in the South are now at high risk for the flu, including Georgia. Atlanta Bureau Chief Archit Seshadri is tracking the latest outbreak from Atlanta.
The CDC says 8% of Americans will get sick from the flu, with children and adults older than 65 at greater risk.
Flu infection is transmitted by droplets, which when you sneeze, when you talk, when you cough, you release these droplets, which has active virus in it.
The CDC says everyone 6 months and older should get the flu vaccine.
So it's extremely important that we get vaccinated, especially the younger population like kids and the older population who are more than 65, because they are prone for complications which could be pneumonia, ear infection, sinus infections, even lung failure.
Doctors say even if you get the flu vaccine, you're not necessarily immune from the flu. You just have last year's strain in your body. So that means if you get the flu, your chances of recovery are much faster.
Flu vaccine may not be 100% effective. No vaccine is 100% effective, but this is effective in preventing the complications.
Several states in the South are now at high risk, meaning there's widespread flu activity.
Right now we're in the middle of a peak in Georgia so far. In the last few weeks, the activity has gone up. And in fact, unfortunately, there was a death of a child from flu-related illness.
And if you do test positive for the flu, doctors say stay at home from work, drink plenty of fluids so that you can reduce getting flu complications. Reporting in Atlanta, Archit Seshadri, Atlanta Bureau Chief.
The CDC says the groups at highest risk of complications like pneumonia, bronchitis, sinus infections are adults older than 65, pregnant women, young kids, and those with pre-existing medical conditions. While health experts say getting a vaccine before October is ideal, it's still not too late to get the flu vaccine so your body can develop immunity during peak winter months.